Did you know that liver cancer is one of the most rapidly rising causes of cancer-related deaths worldwide? What makes it even more frightening? Most people don't even know they have it until it's too late. In this video, we'll dive deep into what liver cancer really is, what causes it, the early warning signs you should never ignore, and most importantly, how you can prevent it. What is liver cancer? Liver cancer occurs when abnormal cells grow uncontrollably in the liver, disrupting its normal function. The liver is an essential organ that performs hundreds of tasks to keep our bodies running smoothly. When liver cancer strikes, it can affect virtually every major system in your body. There are several types of liver cancer, but let's focus on the most common ones. Hepatocellular carcinoma. This type makes up over 75% of all liver cancers globally and occurs in the main liver cells called hepatocytes. Intrahepatic cholangiocarcinoma. This rare cancer affects the bile ducts inside the liver. Hepatoblastoma. This cancer usually happens in young children. Angiosarcoma. This uncommon form of liver cancer arises from the liver's blood vessels. However, over 75% of liver cancers globally are hepatocellular carcinoma, especially in adults over 50. What does liver cancer do? To understand the impact of liver cancer, let's explore what the liver does. The liver is like your internal factory, filter, and fuel station all in one. Here are some of its key functions. Detoxifies harmful substances from the blood, produces bile for digestion, regulates blood sugar levels, stores nutrients like iron and vitamins, makes proteins for blood clotting. Signs and symptoms. Liver cancer is called a silent killer for a reason. In early stages, there are often no symptoms, but as it grows, it begins to send distress signals. Look out for these early warning signs. Unexplained weight loss. Losing weight without trying. This is a common red flag for many cancers. Persistent fatigue. Not just normal tiredness. This is deep, unrelenting exhaustion. Loss of appetite. Feeling full after a few bites or just not wanting to eat. Abdominal pain or discomfort, usually in the upper right side under the ribs. Swollen abdomen. Due to fluid buildup, a common sign of advanced liver disease. Nausea and vomiting. Yellowing of the skin and eyes. Dark urine or pale stools. Itchy skin, due to bile salt buildup. Testing and diagnosis. Because liver cancer can be tricky to spot, doctors rely on tests and screenings to detect it. Here are some key tools used for diagnosis. Blood tests. Checking liver function and levels of a protein called alpha-fetoprotein, which can be elevated in some types of liver cancer. Ultrasound, a non-invasive test that uses sound waves to create images of the liver. It's often the first imaging test done. CT scan or MRI. These scans use X-rays or magnetic fields to produce detailed pictures of the liver, to look for tumors and determine their size, number, and whether they've spread. Liver biopsy. A small sample of liver tissue is taken and examined under a microscope. It helps confirm the diagnosis and determine the best course of treatment. Fibroscan, a special type of ultrasound that measures stiffness in the liver. It's useful to check for fibrosis or cirrhosis, causes and risk factors. Most cases of liver cancer don't appear out of nowhere. They often result from chronic liver damage over years. Let's break down the major causes and risk factors. Chronic hepatitis B and C. These viral infections can cause long-term inflammation in the liver. Over time, they lead to scarring and increase cancer risk by up to 100-fold. Cirrhosis. Scar tissue gradually replaces healthy liver cells. It's usually caused by alcohol abuse, hepatitis, fatty liver, or autoimmune conditions, and is present in most liver cancer patients. Excessive alcohol use. Heavy drinking over years inflames the liver, leading to fatty liver, hepatitis, cirrhosis, and eventually cancer. Non-alcoholic fatty liver disease. A growing concern due to obesity and diabetes. Even people who don't drink alcohol can develop fatty liver and cirrhosis. Aflatoxins. Toxic mold found in improperly stored grains and nuts. It's more common in parts of Africa and Asia where certain foods are stored improperly. Genetic disorders, conditions like hemochromatosis and Wilson's disease can both raise liver cancer risk. Smoking, tobacco toxins damage the liver and may double liver cancer risk. Diabetes and obesity. These conditions cause inflammation and fat buildup in the liver. People with metabolic syndrome have a much higher risk. Top 10 prevention strategies. Liver cancer is largely preventable with the right lifestyle choices and medical care. Let's go over the top 10 science-backed prevention strategies. Get vaccinated for hepatitis B. It's safe, effective, and protects you from a major liver cancer risk. Get tested and treated for hepatitis C. No vaccine yet, but modern antivirals can cure hepatitis C in most cases. Limit alcohol intake. Moderate or stop drinking to avoid liver damage. Maintain a healthy weight. Obesity is a major contributor to fatty liver disease and cancer risk. Control diabetes and high cholesterol. Work with your doctor to manage these with diet, exercise, and possibly medication. Avoid smoking. Tobacco increases liver and other cancer risks. Eat a liver-friendly diet. High in vegetables, fruits, whole grains, low in processed foods, sugars, and red meats. Include foods like turmeric, garlic, green tea, and leafy greens. Be cautious with supplements and medications. Overuse of painkillers, steroids, or herbal remedies can harm the liver. Avoid exposure to aflatoxins. Store grains and nuts properly to prevent mold contamination. Get regular screenings if you're at high risk, especially if you have hepatitis, cirrhosis, or a family history. Foods that help the liver. If your liver loves certain foods, add these to your diet to reduce inflammation, flush toxins, and support overall function. 1. Cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts. 2. Leafy greens, spinach, kale, arugula. They help increase bile flow. 3. Fatty fish. Omega-3 South reduce fat and inflammation in the liver. 4. Coffee. Yes, regular coffee drinkers have a lower risk of liver cancer. 5. Green tea, rich in antioxidants. 6. Garlic activates liver detox enzymes. 7. Turmeric, curcumin protects against liver damage. 8. Berries full of antioxidants that reduce oxidative stress. Treatment options. If diagnosed early, liver cancer can be treated. Options depend on the size, location, and stage of the tumor. Here are some common treatment methods. Surgery, removing the tumor or part of the liver. Liver transplant, if the cancer is small and transplant criteria are met. Ablation therapy, using heat, cold, or chemicals to destroy cancer cells. Targeted therapy, drugs that block cancer cell growth. Immunotherapy, boosting the immune system to attack cancer. Radiation therapy, high-energy rays to kill cancer cells. Conclusion: liver cancer is deadly, but it's also one of the most preventable and treatable cancers when caught early. So take action. Know your risk. Watch for symptoms. Get regular checkups. And protect your liver because it protects you every single day. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more life-saving health content. Leave a comment below if you have any questions or want us to cover more diseases like this. See you next time.